Hey folks, I'm Dr. Gabe Rodriguez and I practice concierge medicine in Helotes, Texas. This month's Medical Minute will be on sleep, specifically shift work sleep disorder, because shift work sleep disorder has been estimated to affect approximately 20% of the presently 22 million American shift workers. I'll start with the basics, move on to the causes, talk about risk factors, discuss associated conditions and prevention, and then I'll end off with some treatments, all of this in about 4 minutes. The basics. We all need sleep to survive. Until Apple or Tesla invents that magic pill that replaces sleep, we will all need to set aside a block of time to close our eyes and rest. Sleep is dependent upon our circadian rhythm. Shift work sleep disorder is a circadian rhythm sleep disorder. So how does this work? Well, let me explain it to you. The human body relies on a natural circadian rhythm, which links the nervous system to the endocrine system. A shift in work schedule can desynchronize this natural circadian rhythm. The major environmental factor that can disrupt the circadian rhythm is light, particularly light at night. Criteria for shift work sleep disorder are 1. Insomnia, 2. Excessive sleepiness during the day, 3. Reduced sleep time associated with a recurring work schedule, 4. Impairment in occupational, educational, or social functioning, 5. These symptoms must be present for at least 3 months. And 6. The sleep disturbance cannot be due to another sleep disorder, mental disorder, or medical disorder, or substance abuse. The cause. Shift work sleep disorder is caused by a misalignment between the internal circadian rhythm and the required sleep-wake schedule due to erratic or nighttime shift work. The most powerful environmental cue for circadian rhythms is the great timekeeper we call light. A desynchrony between our internal clock and external cues, most notably light, is responsible for the development of circadian rhythm disorders and can have a severe impact on both physical and mental health. What are some risk factors? Well, shift work, including night shifts or some early morning shifts or rotating shifts back and forth, day and night, day and night. Being a little bit younger and being a night owl may provide some protection from the development of shift work sleep disorder, and there is no genetic predisposition to shift work sleep disorder. We do this to ourselves. Associated conditions. Circadian rhythms are evident in multiple biologic functions, including our body temperature, hormone levels, blood pressure, metabolism, and cellular regeneration. Shift workers may have impaired immediate free recall, decreased processing speed, selective attention, and impairments that may worsen with longer duration of shift work. Shift workers also have been shown to have a much higher risk of motor vehicle accidents, job-related injuries, and quality control errors. Shift work sleep disorder has been associated with GI disease, specifically peptic ulcer disease, cardiovascular disease, ischemic strokes, infertility, mood disorders, and pregnancy complications. There is also evidence for possible increased risk of breast cancer and prostate cancer, and because of this, the International Agency for Research on Cancer has classified shift work that involves a circadian disruption as a probable carcinogen. How can we prevent this? Well, limit rotating your shifts. Use of bright light during your night shifts may help, and scheduling a brief nap, 20-30 minute naps during shifts if possible, may also help with prevention. Treatments. Well, 1. The only therapeutic modality deemed standard by the American Academy of Sleep Medicine is planned or prescribed sleep schedules. You need to sleep. 2. Optimizing proper sleep hygiene. Examples are minimizing exposure to bright light before and during scheduled sleep periods, maintaining a quiet sleep environment, disconnecting your phone, wearing earplugs to sleep, disconnecting the doorbell, having a nice, cool sleeping quarters. 3. Bright light in your work environment can promote adaptation to night work. Also, taking some melatonin to help sleep, caffeine to give you that little perk in the morning, those may help. 4. Encourage healthy eating habits, limit substance use, exercise at least 30 minutes 3 to 4 times a week. 5, reduce the number of consecutive shifts to less than 4. Reduce your shift duration to less than 12 hours if possible. And 6, final treatments involve the use of medications, which I'll talk about right now. There are the sleep-promoting medications that may be useful, such as melatonin or Ambien or Lunesta. These may help increase the quality and the duration of sleep. Try to stay away from benzos if possible. They have a high risk of tolerance and withdrawal and should be used cautiously for short-term periods of time for insomnia. And there's also wakefulness-promoting medications such as Provigil and Nuvigil. These are approved for excessive sleepiness during the day for patients with shift work sleep disorder, and they can reduce the daytime sleepiness and improve your cognitive performance. Also, you can use prophylactic caffeine immediately prior to your work shift or during your work shift if necessary. That's all I have today, folks, on this month's Medical Minute topic of shift work sleep disorder. Thanks for listening. Take care and be well. Remember, your health is your greatest wealth. Thanks. So long.